Thanks for allowing me to participate in this subcommittee. I appreciate it. Thanks for holding the hearing. Uh, the Zika outbreak, while a global issue, is especially pressing in Florida and other Gulf states, given that these locations are vulnerable to the spread of Zika. In Florida, we already have 2 cases in Hillsborough County, one of the counties that I represent. A question for Dr. Borio. You mentioned innovation strategies being proposed to help suppress virus-carrying mosquitoes. It is my understanding that the FDA is currently considering an application for a field trial with genetically engineered mosquitoes in Florida. The question is, could you update us on where the field trial application stands today and when the earliest starting date could be?
Thank you. So we are working to soon release for public comment the draft environmental assessment that the company developed. We work closely with EPA and CDC in reviewing the materials. So hopefully very soon we'll be releasing that for public comment. Once we have an opportunity to review the comments we receive from the public, then we'll make a final decision regarding the application. We're expediting the process very much greatly. It's part of our emerging infectious disease task force in response to Zika. So the reviewers involved in this technology are part of our emergency response task force. So we're doing everything we can to move this as expeditiously as we can.
Well, give me an estimate.
Yeah, I'm unable to give an estimate at this time because it really will depend a little bit on the volume and interest from the public. We are working
I'm
those
sure
issues.
there's a great deal of interest in based on what my constituents.
Yeah, it has been an area of tremendous interest, and including some opposition. I think what we don't know right now is where the public stands in the setting of Zika and the new developments associated with Zika. So we're doing everything we can to move this very quickly. We're collaborating across government, the CDC and EPA. We learned a great deal about this technology also during my visit to Brazil last month. So what I can tell you right now is that we are prepared to move very quickly on this.
Thank you. Next question. You mentioned FDA's emergency use authorization when referencing diagnostic tests. Would FDA be able to use an emergency use authorization to advance the use of this technology should the Secretary declare a public health emergency? So if you can answer that question.
Our EUA authority is currently limited to human products, not to animal products. And this technology is regulated under our animal drug regulation, so it's separate. So we do not have currently authorities on emergency use authorization for animal drugs.
Okay, next question. Are there other innovative products or strategies being proposed that you're aware of and able to discuss at this time?
I would like to defer those answers to my colleagues from CDC and NIH.
Please.
There are a variety of other mosquito control approaches that are being considered. One is simply to optimize our currently available products. And we think there's considerable progress that we could make by doing that. Different ways of applying, different combinations of products, different ways of assessing mosquito populations after the application of these products. That's very important and needs to be done. In addition, there are new tools that are exciting. One of them is the genetically modified mosquitoes that you mentioned. Another is Wolbachia, a bacteria that infects mosquitoes and then can reduce their life expectancy and their ability to spread disease. This has been done on a pilot basis, but again, the question about all of them are they scalable? Will they reduce human disease? Are they practically implemented? And NIH is doing work in this area as well.
Anyone else wish to comment on this? Thank you. Right now, there are 3 tests, I understand, for detecting Zika during different stages of infection. It is my understanding that Florida and a few other jurisdictions are able to utilize the RT-PCR test to detect infection. However, given that those who are infected often don't show symptoms, it seems crucial that we are able to disseminate diagnostic capabilities, such as the antibody testing, to state and local authorities. So what hurdles do we face in increasing access to these diagnostic tests nationwide?
Yeah. We're working around the clock to do that. We've already produced 375,000 of the real-time PCR. We've got roughly 15 to 20 states already approved for use of that. Now with the IgM EUA just last Friday, we expect to have another 15 or 20 states approved for that. That's where most of the returning travelers live, and we'll continue to produce them. We've been able to accelerate our production capacity at CDC so that we can increase the proportion of the need that's met, but we recognize that there may be a period of weeks or a month or two where people who want to test can't get it. We're in active discussions, as is BARDA and other parts, to encourage the private sector to do more in this area. But right now, the CDC-developed test, which scientists at CDC spent years working on, is the best thing out there in terms of what's available, and we're working around the clock to make it more widely available.
All right, well, thank you very much, Mr. Chairman. I appreciate it. I yield back.
I know we're done with this. I know Ms. Clark has 1 minute.